A very good day to one and all. So this class is on pharmacological behavior management. So pharmacological behavior management basically includes the pre-medications, conscious sedation, then your general anesthesia. These are the three important topics which we will be discussing in the chapter pharmacological behavior management. So pre-medication includes your commonly used sedatives, hypnotics, then anti-anxiety drugs, antihistamine, steps in conscious sedation, and steps in general anesthesia. So today's class I will be covering the common pre-medications, the guidelines which the pre-medications should be given, then the basic steps in conscious sedation. And the next session we will be discussing about the general anesthesia and its steps. So moving on to the pre-medications. Pre-medications refer to drugs given to a patient before any procedure. That is why we call it as pre. Pre-medication is something which we give, a drug which is given prior to the patient before any procedure like a general anesthesia or a conscious sedation procedures to reduce anxiety or any kind of post symptoms, to reduce the post-operative symptoms. We give pre-medications, or even the prophylaxis we call it as pre-medications. So there are certain guidelines for the use of these pre-medications. So a detailed medical history should be taken to prevent undesired drug reactions. That means in case if the patient has some allergies or any systemic conditions, it might undergo some reaction and which will cause anaphylaxis or any kind of reactions which will lead to the some other problems or adverse effects to the child. The decision to use pre-medication should be done before one resorts to sedatives, conscious sedation, or general anesthesia. So that is how we decide whether the child should be given a pre-medication or not. Selecting a pre-medication agent depends upon the properties, effects, dosage, duration of action, hypersensitivity, etc. The type and dosage should never impair the vital reflexes of the child. As I've said earlier, the decision to use pre-medication should never impair the vital reflexes of the child. Even while selecting also, we should always know what are the properties of that particular drug, its effects, and if there is any side effects, the dosage, pediatric dosage and adult dosage, duration of action of that drug, and in case if it causes any hypersensitivity reaction or any drug interaction, if you're giving some combination drugs, you should be able to know if there is any problem or associated reactions which might cause if they're combined with any drugs. Then consent and pre-operative instruction should be given before any procedure. If you're doing conscious sedation, even whatever procedure for a child, if you're doing something, even for a simple restoration cell, we should definitely require a consent. So just imagine for a procedure like which involves conscious sedation and general anesthesia, it should definitely involve consent and preoperative instructions. This basically reduces parent anxiety. Instructions include the methods of administration of the drug, its safety precautions, side effects of the drug, dietary precautions, etc. So parents should accompany the child whenever you're giving a pre-medication. You have to accompany the parents along with the child. Then they will not, like, this is basically when you're treating a child, it's like a combined effect. Like the parent anxiety is also showered upon the child. So it is always better to have a detailed instructions, give a detailed instruction to the parent first so that the parent will understand, and even the parent will help in making the child understand the procedure. So it is very important to get a consent and preoperative instructions. So high level of personal training is must. So whenever you are giving whatever you are giving, a personal, that profession, that person should be trained properly to give all these things. And call for documentation of events during the treatment, example, vital signs, etc. And assistants other than the operatory must participate in the procedure to constantly monitor the physiological parameters. So whichever drugs you're giving, there should be an assistant who is throughout monitoring the vital signs and the parameters, whichever is recorded during the procedure or while giving the medications. Post-operative care includes discharge only when vital signs are stable patient is alert, can walk with minimal assistance. So these are the basic guidelines which you should be given before giving the pre-medications and to be followed. After giving the pre-medication also, what are the things which you should follow is given. So post-operative care should also be included. Like if there is any interaction or adverse effects after the procedure or before the procedure, you are supposed to instruct the patient accordingly and care should be taken. So basic agents which is used for pre-medication in general anesthesia are one is your anticholinergics. So in infants under the age of 1, atropine is given 0.02 milligram per kilogram IV during anesthesia or IM 30 minutes before. So for healthy children 1 to 3 years of age, atropine 0.02 milligram per kilogram IV during anesthesia or IM 30 minutes before. And healthy children over 3 years of age, optimal physiological development, it is indicated to give diazepam 4 milligram per kilogram suspension. And even there are sedatives and even antiemetic. Antiemetics is given because one of the most common post-operative symptom, post-treatment symptom is nausea, vomiting. So it is always better to give them sedatives to reduce the anxiety, and the antiemetics like hydroxyzine, then metoclopramide. These are the most common drugs which is used as antiemetics during the general anesthesia procedure, the conscious sedation procedure. Agents which are used for pre-medication sedations are, they can be sedative hypnotics, anti-anxiety drugs, or analgesics. So analgesics is basically given to reduce the post-operative pain. Sedatives and hypnotics, anti-anxiety drugs, and analgesics are the most common agents which is used as pre-medication, used for pre-medication. So moving on to the sedation. So whenever you are learning about the pre-medications, you are supposed to know the guidelines and the most common classifications and the agents which are used as pre-medications and the example with the dosage. So please study that accordingly. So we will move on to the sedation in detail. So this is one question which you will get, like this is one of the questions which has been repeatedly asked and even for Viva, definition of conscious sedation. So conscious sedation, it is nothing but a minimally depressed level of consciousness that retains the patient's ability to independently and continuously maintain an airway and respond appropriately to physical stimulations or verbal command, and that is produced by a pharmacological or non-pharmacological method or a combination thereof. So this is basically when you're giving a conscious sedation to the child, it is basically, it is nothing but patient who does not go unconscious. So here the patient will be, his or her mental state will be minimally depressed. The consciousness will be minimally depressed. And here in this condition, the patient will be able to respond to whatever verbal commands you're giving. If you ask the patient to raise his or her hand, they should be able to do that. So verbal and physical stimulus response should be there accordingly. So that is how a conscious sedation will help, and that is what conscious sedation is. There are various routes of administration of drugs. Here we can give inhalation, oral, rectal, parenteral acid, intramuscular, submucosal, and intravenous. So the basic concept of sedation in general anesthesia, there is something known as levels of sedation. So levels of sedation includes minimal sedation, that is formerly anxiolysis, then moderate sedation, formerly conscious sedation or sedation, or even analgesia. Then a deep sedation, and after that comes your general sedation, where the child or the patient completely go unconscious. So there are certain status and responsiveness. What happens to some? There are certain vitals which we check when you're giving a minimal sedation, moderate sedation, deep sedation, and general anesthesia. So we'll see what are the differences in the responsiveness, airway, ventilation, and cardiovascular system. So for a minimal sedation, normal to verbal stimulus. So child or the patient will definitely respond to the verbal stimulation, and the airway is properly maintained here, ventilation will be normal and cardiovascular signs will be normal. Whereas in moderate sedation and conscious sedation, purposeful to verbal or a light tactile stimulation. So there will be, it is a slightly depressed level of consciousness when you compare to minimal sedation. So here there will be that level of suppression will be more in moderate sedation. But here, as you can see, the airway and the ventilation is maintained properly and it is adequate, and even the cardiovascular signs are maintained in a normal level. For a deep sedation, it also includes purposeful to repeated or painful stimulations. So here the airway may need intervention, and we have to check the airway ventilation and the cardiovascular system. It should be maintained in a normal basis, and it might require intervention for airway and ventilation. General anesthesia means the responsiveness will be null. There will be no response to painful stimulation, and definitely requires intubation, often needs interventions for airway and needs assistance for ventilation. Then a cardiovascular system is usually maintained by drugs and all. So here the ventilation is given by the anesthesia unit or an ambu pump, and even the airway needs a proper intervention. So that is the basic difference between minimal sedation, moderate sedation, deep sedation, and general anesthesia. So here, before undergoing such procedure, we have to understand what is the AAC physical status of the patient. So AAC, American Society of Anesthesiologists, have divided the physical statuses into 5, like class 1 to class 5. So class 1 patients are nothing but normal healthy patients. Whereas class 2 is patient with mild systemic diseases. Here example, controlled reactive airway diseases will be there. So we call them as class 2 ASA. ASA class 2. Whereas ASA class 3 is a patient with severe systemic disease. Example, a child who is actively wheezing. So they will be classified under ASA 3. And class 4 is a patient with severe systemic disease that is constant threat to life. Example, the child with status asthmaticus. So here the child will have a severe airway dysfunction. So we call it as ASA 4, and the interventions should be needed, or everything should be ready in case if the patient has some kind of complications. And ASA 5 is a morbid patient who's not expected to survive without the operation. That means it is a high-risk category. For example, patient with severe cardiomyopathy requiring heart transplantation. So in that condition, without an operation, the patient won't be able to survive. So even with high risk, we are supposed to give them anesthesia. So there will be life threat. So we call the classify them under the class 5 category, ASA 5 patient. So before taking up the patient, we should be able to identify which category of ASA, which class does the patient belongs to. And most of the general anesthesia where the patient undergoes dental treatment, we won't, like, it will definitely come under class 1. But unless if the patient has any systemic diseases, then we'll have to divide it as depending on the airway problems or any other underlying systemic diseases, the grade might change. But mostly, if the patient is taken care under consideration of general anesthesia, the majority of the patients will be normal, ASA class 1. Whereas if the child requires any clearance for the cardiac surgery or any other surgical procedures, then it might vary based on the child's systemic illness. So consideration basically aids in erasing fear, anxiety, and apprehension, helps to reduce patient motion, then creates a semi-hypnotic state. That is a major hyperreaction or movement will not be possible when the child is under sedation. Increases tolerance for longer appointments, slightly raises the pain threshold. So even if the patient will be able to becomes highly cooperative and maintaining the consciousness of the child. So basically sedation indications are fearful, anxious patients for whom basic behavior guidance techniques have not been successful and patient unable to cooperate due to lack of psychological or emotional maturity or mental, physical, or medical disability. So it does not completely belong to the special child category, but some patients who are which we can handle them for a consultation unit, only these patients are the candidates for undergoing such procedures. To protect the patients developing psych in very young children, then to reduce the patient's medical risk also, we can indicate sedation. Some of the contraindications are the cooperative patients with minimal dental needs, we might not require a conscious sedation. As such children, treatment can be done on the dental chair with the local anesthesia. And predisposing medical conditions which would make sedation inadvisable as follows, like hypersensitivity to agent, chronic obstructive pulmonary disorders, psychiatric patients, cardiac patients, epilepsy, and even bleeding disorders. So these conditions are contraindicated and can be with the consent of the physician and the pre-anesthetic clearance. Patient can be taken with for the general anesthesia if it is an emergency condition. So basic advantages are patient is here conscious, so we will be able to get the proper response from the child. And relative safety is there. Least disturbs the metabolic process and general function, has all vital reflex intact and communicate and cooperate, quickly return to normal state after few minutes. So it is a controllable state. Rapid onset and recovery time because of very low plasma solubility, and ease of dose control is there, lack of serious adverse effects and produces euphoric effect. That is one of the side effects which you commonly say for using the laughing gas. Major disadvantages are weak agent, not so effective in moderate or severely anxious patients, as dose cannot be increased. So there is always a limit in increasing the dosage. So if the patient is moderate or severely anxious, we won't be able to control them even after giving the sedative agents. So lack of patient acceptance, some may not like it. So there will be a difficulty in administrating the drugs to them. Then inconvenience when inhalation is used, the mask may hinder exposure to the oral cavity, especially in the children. And one of the major disadvantages is the potential chronic toxicity. Retrospective survey studies of dental office persons who were exposed to trace levels of nitrous oxide suggests a possible association with an increased incidence of spontaneous abortion, congenital malformations, certain cancer, liver diseases, kidney disease, and neurological diseases. This is basically chronic toxicity which you are continuously exposed to such gases and which obviously will have a side effect. So inhalation sedation, most commonly we use the nitrous oxide. Nitrous oxide is the gas that is used for the moderation through a nasal route, and it is a colorless, odorless, heavier than air, and specific gravity is around 1.53. It is a non-inflammable gas. It is absorbed quickly through the alveoli of the lung and is physically dissolved in the blood with no chemical combination anywhere in the body. That is one of the major advantage of using nitrous oxide. And the pharmacodynamics of nitrous oxide creates an alternative state of awareness without impaired motor function, and is a central nervous system depressant. So basically, CNS is depressed when you're using a nitrous oxide. It increases the respiratory rate and decreases the tidal volume. So these are the respiratory outputs, like which changes which happens when you're using nitrous oxide. Cardiac output is decreased and peripheral vascular system is increased. So it is basically important in cardiac patients to maintain this level. So rapid induction and reversal may induce vomiting. That is one of the side effects. The objectives of nitrous oxide or oxygen inhalation includes it reduces or eliminates anxiety, reduces on-toward movement and reaction to the dental treatment. So highly uncooperation or physical movement can be restrained by using this, and enhance communication and patient cooperation, raise the pain reaction threshold like highly, like there's a drastic change for the pain threshold. Increase tolerance for longer appointments, aid in treatment of mentally, physically disabled or medically compromised patients, reduces gagging, potentiate the effect of sedatives. So here also, as we have discussed the indications of general sedation unit, you can write the same thing. It is basically used in fearful, anxious, or obstreperous patient, certain patients with physical healthcare needs, a patient whose gag reflex interferes with dental care, and a patient for whom profound local anesthesia cannot be obtained, and a cooperative child undergoing dental. In lengthy procedures A cooperative child undergoing a lengthy procedures also, like we can make use of obstreperous means it is a patient who is very difficult to control or very loud or basically an uncooperative child. Then the pharmacodynamics, absorption, metabolism, and excretion, that is, enters blood by crossing pulmonary epithelium and depends upon the concentration gradient. And during early phases of administration, brain, heart, liver, and kidney absorbs the major portion of the nitrous oxide from the blood. And this gas is expired basically through the lungs only. And requirements of the equipments used for the induction of the nitrous oxide, it should have a continuous flow design with flow meter capable of accurate regulations, then automatic shutdown of oxygen level falls less than 20%. Flush level for easy and immediate flushing of the system with 100% oxygen and can be either mobile unit or operating from a central supply. That means you should have a unit which supplies both oxygen and nitrous oxide. Good and efficient scavenger system. It should have a good and efficient scavenger system. Nasal hood should be of adequate size for adults and children. So there are different sizes available for adult and children. So that should be adequate. So gas shouldn't leak unnecessarily out from the nasal hood. So the proper pictures are all given in your textbooks. Please go through that. Technique is nitrous oxide must be administered only by appropriately trained individuals. So this is how the nasal hood will look like. This is how the gases will be distributed. So a thorough inspection of the equipment should be done before placing or doing any procedure. Place the mask over the nose. Bag is filled with initially 100% of oxygen is delivered to the patient for around 2 to 3 minutes. The complete 100% oxygen is given. And slowly by reducing the oxygen level, we'll introduce the nitrous oxide. To encourage the patient to breathe through the nose alone. Explain the sensation to be felt, floating, giddy, tingling of digits. These are the sensations the patient will be having. Adjust the concentration to 30% nitrous oxide and 70% oxygen. And then carry out the procedure with continuous monitoring. After completion of the procedure, give 100% oxygen for the 5 minutes. So this is basically to remove all the nitrous oxide which is found in the lungs, and so that this oxygen will get replaced by all these things, and the excess nitrous oxide will get exhaled. So basic summary of conscious sedation is selection of the patient is very important. Consent is definitely required before doing any procedure. Instructions to the parents as well and even the patient. Patient should be prepared before. And administration of sedation agent, monitoring the patients, even the vitals has to be monitored. Treatment completion, discharging of the patient is done. Discharging should be done only after making sure the patient is completely awake and conscious. So when you're administrating nitrous oxide, there are certain symptoms which the patient might show. When you are giving 10 to 20% of nitrous oxide, the common symptoms are tingling feeling, that means paresthesia. Sensation of warmth will be there. When you increase that percentage to 20 to 40%, the patient might feel numbness of the extremities. Floating sensation, auditory changes will be there, distant humming noise. Then analgesia and euphoria will be achieved by 20 to 40% nitrous oxide. And if it goes beyond that, 40 to 60%, the patient starts dreaming, laughing, or giddiness will be there, sweating, nausea, and vomiting. Uncoordinated movement is usually seen, and loss of eyelid reflex. So this is one of the questions which you might get when you are learning the pharmacological behavior management techniques. Basic difference between conscious sedation and general anesthesia. So in conscious sedation, treatment done in several appointments, whereas in general anesthesia, all procedure done in one appointment. And conscious sedation is used in cooperative but unconscious and fearful patients, whereas GA is used in highly uncooperative patients. A need for basic preoperative instruction is required, whereas for GA, a thorough, even the serum levels, serum antigen levels, then complete CBC, complete blood report should be taken for before taking general anesthesia. Patient is conscious during the procedure when you're doing a conscious sedation. Whereas in general anesthesia, patient is unconscious. Reflexes and airway is maintained and patient need not be starved before procedure, but light stomach is preferred. Whereas in general anesthesia, reflexes are lost. Patient will be able to move. Ventilation is definitely required with the anesthesia unit and requires to have an empty stomach at least 6 hours before the procedure so that the patient will not regurgitate and undergo aspiration of the liquids, whatever is present in the stomach. The basic common problems associated with nitrous oxide are sleep. Patient may go into sleep during the procedure. So that is something which we might not like it because the airway or mouth opening will be restricted and you will not get proper response from the patient if you want something. So airway obstruction might happen, vomiting, nitrous oxide may fill up middle ear space and in patients with otitis media can cause acute pain when you're using. And diffusion hypoxia is one of the most commonest problem associated with nitrous oxide. Impotence, neurotoxicity, inland liver toxicity is seen in when it's a chronic adverse effects when you're using nitrous oxide. So that is with the briefly, that is generally like the things which you should know when you're using conscious sedation is completely discussed in this session. And in the next session, we'll be discussing on how general anesthesia is done, what are the procedures which you should follow, etc. Thank you for the patient listening. Thank you.